Dr. Professor P.C. Manoria, Executive President, Third World Congress Cardiometabolic Medicine, Mumbai, 27-28 January, Hotel Leela. And with me is Dr. Professor Sareen at TheRightDoctor.com studio. And we will be discussing about the NFLD, NASH, and the liver fibrosis. Dr. Sareen, Professor Sareen is an unmatched hepatologist. There's no match with any other hepatologists of the world. So Dr. Sareen, all of us know NFLD, NASH, fibrosis, cirrhosis, malignancy are very important problems. They are rampant around the globe. India falls in the high risk category, 25 to 30%. You initiated a national program, but less attention is being paid even at the presentative time, looking at the numbers of NFLD which you had projected. So what do you think else should be done to make it a little faster and cover more population?
Thank you, Dr. Manoria, first to invite me to this very important cardiometabolic conference. I learned a lot from the experts that you have called, and the topics were very useful. The fatty liver disease, today India's data is about 38% of the Indians, or put it other way, 42 crores of Indians are nearly having fatty liver, and in the age group of 15 to 24, nearly 24 crores are having fatty liver. So this is a bigger pandemic than COVID or any other pandemic ever known, and totally unrecognized, as you rightly say. Neither the doctors nor the public is aware of the huge burden and challenges due to fatty liver. To put it, only 1% of the physicians are really appreciating. Otherwise they will say, क्या फर्क पड़ता है, उसके भी है फैटी लिवर, उसके भी, मेरे भी है, डॉक्टर के भी है, पर वो ध्यान नहीं देता. जैसे आग लग रही हो, फायर अलार्म बज रहा हो, आप सुने नहीं. But why is it important is because fatty liver is the core. Liver actually is the core of your metabolic whole factory. So similarly, an abnormal liver is the core for all diseases also. Health के लिए भी liver चाहिए, और डिजीज होगी तो भी लिवर से शुरू होगी. तो ये कॉन्सेप्ट और इसको बढ़ाना, आप जैसे एक्सपर्ट्स जो कि ट्रांसडिसिप्लिनरी हैं, हार्ट, लिवर, ब्लड प्रेशर सबको मिलाएं, तभी जाकर के ये भारत में आएगा.
Usually when we see a physician, he looks as NFLD as a focal disease.
Yes.
When it is an indicator of metabolic ill health, which is rampant in so many, heart, blood vessel, kidney and so on. The other issue is we see that as fibrosis is initiated and it progresses, the mortality rises steeply. So what are simple methods to detect whether a patient of NFLD has transformed into fibrosis?
Yes. A patient of NAFLD, if he has a FIB4 score, FIB4 is simple, everybody can do. It has platelets, age, AST and ALT, which are simple tests, may not be even 30 rupees. A FIB4, if calculated on the internet, if it is above 2.37, or in other simpler words, if your platelet count is less than 100,000, or if you are overweight or obese, then you should be concerned. The other three categories which need immediate attention all over India is every diabetic. Whether you are lean or overweight, a diabetic has a high risk, and suppose the diabetic is 40 years and he has just diabetes for 5 years, his risk of disease because of liver is 13 times, and death due to all causes is 5 times more than general population. So diabetic is also the commonest cause of liver cancer today. Today if you take 100 cases of liver cancer, 40 are due to diabetes. So diabetics are at high risk, they have fatty liver, and as the fibrosis progresses in the liver, other organs are also hard. Your heart is stiff, your lung is stiff, your kidney is stiff, brain is stiff. So liver fibrosis, which can be assessed in 2 minutes time, either by blood test or by liver stiffness measurement, is the first test, I would say, after hemoglobin or ALT is the first test, not doing ultrasound, simply going to fibrosis of your organ as a marker of your longevity or early death.
See, we have a component of fat deposition, we have a component of inflammation, we have a component of fibrosis. So what are various drugs which remove fat from the liver, which decrease inflammation and which ultimately affects fibrosis? So can we have a comment on this?
Comprehensively, first is change in your attitude. Two is reduction in your weight. If people have reduction in weight by 10% if the person is overweight or obese, or by 5% if the person is already low weight or normal weight, then the inflammation comes down, because it is fat which invites white cell which are killed. After the liver cells are killed, the ALT goes up. So a high ALT is a bad marker. So how you handle it? Weight loss by 10% or more. Third is a important thing is called the exercise. How exercise helps? The muscles release myokines. Myokines talk to every organ, especially liver, and they regenerate the organs and reduce insulin resistance. The fourth part is about drugs that you asked. I would say today the drug is no specific drug for NAFLD. The only approved drug in the world is in India is a saroglitazole, which has some benefit in reduction in the fat in the liver, some in the fibrosis. My preference is first change in the diet. Reduce your diet, don't use a dinner plate, use just a dessert plate, smaller plate for all your requirements. There is a importance of time restricted eating. The third is drug of choice for me would be metformin if he is diabetic or insulin resistant, and yes, newer drugs like GLP-1 agonist or SLG inhibitors, they can be tried. But today lifestyle is the most important and diet is the most important.
A new test ELS is in vogue, enhanced
Yes.
liver fibrosis. Can you tell something about this and which subset of Indian patient is useful?
ELF is the new test, which is your extended liver fibrosis panel. This test is commercially now becoming available. We use it routinely for our patients for assessing fibrosis. The advantage of blood test is that you can do it multiple times. You can't do biopsy multiple times or fibroscan multiple times. So ELF, if it is above 9.7, it has three components, and if it has above 9.7, it is worrisome. Above 11, it is strongly suggestive of maybe even stage 3 or 4 fibrosis. So I suggest first do FIB4. If it is high, then you should see a specialist, or ELF to see whether there is a high value. And of course, you have to get a liver stiffness once in life. In general population, we did about close to 25,000 people in Delhi in general population, and you would be surprised that nearly 30% of the people have either abnormal test, 7 or 8% have fibrosis of stage 2 or more.
So somebody comes at F3 stage. Can anything be done? F course, of course, is
Yes.
gone. So can you reverse it to
Yes.
F2?
Very good question. And F3 stage can be brought down to F2 simply by changing lifestyles. I would say using metformin. You can use saroglitazole, or you can also use combination with obeticholic acid and a GLP-1 agonist. F2, F3, you can reverse F3 certainly. But F4, yes, it's a bit late stage, cirrhosis has set in. So don't let your patient go to that stage, and pick the relatives. If there is one patient, the chance that the second relative in the family has fatty liver or fibrosis is about 60%. I recommend using the polygene format, where the polygene R4, PNPLA3, you have MBOT, you have GCK and HSD. All these 4 genes can decide, are you a rapid progressor and what is your risk? What manufacturing defect have you inherited from your parents? So these are tests which I think experts should start using.
The last issue is Indians are thin fat Indians. So they are thin, they may not have obesity. So how do you make a diagnosis of lean NASH in these? How do you confirm the diagnosis?
So firstly, if there is a genetic history. 2, if you do a simple visceral fat assessment. So a patient may be, or a person may be looking BMI 22, but his visceral fat compared to the Europeans or Americans may be 2 to 3 times more in India. So the visceral fat inside is genetic and it is very resistant and is very harmful. The method for detection can be a good DEXA scan, which also picks up visceral fat. Better method is MRI PDF, which is proton density fraction analysis by MRI, is not easily available. A CT scan can also give you a visceral fat content. The body composition analysis, bioimpedance, very easily available, gives you proportion of visceral fat indirectly. It also gives you your muscle. So if your lean muscle mass is less, normally total body percentage, fat percentage should be 20%. Suppose it is 40% and your muscle mass is less, you know that your muscles need to be added, fat needs to be reduced, visceral fat needs to be reduced. I would strongly suggest going into the Indian way like Dinacharya, doing halasan for people who have a genetic history, and also visceral fat assessment should be done, and ALT monitoring should be done at least once in a year or so, that your SGPT is not above 20 for a female and for 30 for a male, not use 40. Lower the SGPT or ALT, healthier you are, less inflammation you have.
So thank you very much, Dr. Sareen, for the excellent takeaway. Thank you very much.
Thank you so much.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.